Have you ever wondered why some diseases become pandemics while others don't? What if I told you that there is a fascinating science behind it? Welcome to the Intrigue of Pandemics. Now, you might be thinking, what exactly is a pandemic? Well, it's when a new disease spreads across countries or continents, affecting a large number of people. We've all seen the devastation they can cause, from the Spanish flu in the early 20th century to the H1N1 virus in 2009, and most recently, the 2019 pandemic. Now, not all diseases become pandemics. So what's the secret ingredient that catapults a disease into this global stage? It's a mix of factors, really. The disease needs to be novel, meaning people haven't developed immunity to it. It has to be able to spread efficiently from person to person, and it needs to cause severe illness or death. Let's take the common cold, for example. It's highly infectious, yes, but it doesn't cause severe illness in most people. So, it's a nuisance, not a pandemic. On the other hand, diseases like HIV or Ebola are very severe, but they don't spread as easily, so they cause outbreaks, not pandemics. But when a disease checks all these boxes, like the H1N1 virus did in 2009, or the novel coronavirus did in 2019, it can spread like wildfire, jumping from country to country, continent to continent, leaving a trail of devastation in its wake. Understanding these factors is not just about satisfying our curiosity. It's crucial for our survival. It helps scientists and public health officials predict and prepare for future pandemics. It helps us understand how to slow them down, save lives, and eventually, hopefully, stop them in their tracks. By the end of this video, you will have a better understanding of the anatomy of a pandemic. So sit tight, buckle up, and let's dive deeper into the fascinating world of pandemics. It's going to be an enlightening ride. Pandemics don't just happen overnight, they have a beginning, a middle, and hopefully an end. Our journey into understanding pandemics takes us to a starting point we might not expect: the animal kingdom. A significant number of the world's most devastating diseases have their origin in animals. These are known as zoonotic diseases. From the Black Death in the 14th century to modern-day afflictions like HIV/AIDS, Ebola, and even the recent pandemic, zoonotic diseases have consistently impacted human history. Now, you might wonder, how do these diseases make the jump from animals to humans? The answer lies in our interactions with animals. It could be through direct contact, consumption of undercooked meat, or even a bite from an infected insect. These interactions provide the perfect opportunity for pathogens to cross over into human hosts. Once a zoonotic disease has made the leap to humans, it needs to achieve one more feat before it can become a pandemic: human-to-human transmission. This usually happens when the pathogen mutates, allowing it to spread easily from person to person. This transmission could be through the air, by touch, or even through shared objects. The speed and extent of the spread depend on several factors. These include the nature of the pathogen itself, the density of human population, and our response to the outbreak. The more contagious the pathogen and the denser the population, the faster it spreads. On the other hand, swift and effective containment measures can slow it down or even stop it in its tracks. But here's the catch. We often don't realize a pandemic is brewing until it's too late. The initial cases might seem like isolated incidents, and by the time we connect the dots, the disease has already begun its march across borders. The birth of a pandemic is a series of unfortunate events, a perfect storm of sorts. It's a complex interplay of biology, ecology, and human behavior. And understanding this process is the first step in our fight against these global health threats. 2019 saw the dawn of a new pandemic that brought the world to a standstill. A novel virus emerged, casting a shadow of uncertainty and fear that gripped the globe. This pandemic, which began in late 2019, unfolded like a case study in how modern infectious diseases can spread and disrupt societies. The virus surfaced in a bustling metropolis, a city where millions live and work. It was in this urban landscape that the virus found the perfect breeding ground. Dense populations, close quarters, and constant human interaction gave the virus the opportunity to multiply and spread. But the virus didn't stop at city boundaries. It hitched a ride on airplanes, trains, and automobiles, propelled by the engine of international travel. The virus crossed borders and time zones, reaching every corner of the globe in a matter of weeks. Our interconnected world, so often a source of strength, became a highway for the virus. Globalization too played a crucial role. Today, we are more interconnected than ever before. Our economies, our cultures, our very lives are intertwined. And as the virus spread, it revealed the fault lines in this global system. Supply chains faltered, economies faltered, and societies faltered. The pandemic was not just a health crisis, it was a crisis of our globalized world. And what of the global response? Nations and health organizations around the world rallied, working together to understand the virus, to develop vaccines, to protect their populations. It was a monumental effort, a testament to human resilience and ingenuity. Yet, despite these efforts, the virus still claimed millions of lives and disrupted countless more. The 2019 pandemic was more than a health event. It was a global phenomenon, a complex interplay of biology, society, and politics. It reminded us of the power of infectious diseases, of their ability to exploit our vulnerabilities and disrupt our lives. The 2019 pandemic was a stark reminder of our vulnerability to infectious diseases. It underscored the need for vigilance, for preparedness, for global cooperation in the face of such threats. Because, as history has shown us, this won't be the last pandemic we face. Once a pandemic starts, how do we stop it? Can we even stop it? A question that lingers in the minds of many. The answer lies in our collective actions and a deep understanding of the measures we can take. Firstly, let's consider social distancing. It's not just about keeping a safe distance from others. It's about reducing the chances of the virus spreading from person to person. It's like throwing a wrench into the gears of a well-oiled machine, slowing down the pace at which the virus can spread through a population. Then we have the simple yet powerful tool of wearing masks. Masks act as a physical barrier, catching droplets that may contain the virus. They protect both the wearer and those around them. Think of masks as your personal portable fortress against an invisible enemy. However, these measures alone aren't enough. That's where vaccines come into play. Vaccines teach our immune system how to fight the virus, equipping it with the necessary tools to defend our bodies. It's akin to training an army to be ready for a battle that's yet to come. But the fight against the pandemic is not a lone battle. It requires international cooperation, sharing of information about the virus, its spread, and effective measures to combat it is vital. Countries need to work together, pooling resources and expertise to wage a successful war against the pandemic. Moreover, the role of a robust public health infrastructure cannot be overstated. It's the backbone of any pandemic response. It includes everything from hospitals and healthcare workers to testing facilities and contact tracing systems. With a strong health infrastructure, we can identify, isolate, and treat infected individuals more effectively. And finally, it all boils down to individual responsibility. Each of us has a role to play. By following guidelines, getting vaccinated, and taking care of our health, we contribute to the larger fight against the pandemic. The fight against the pandemic is a global effort, and it requires everyone's participation. So, let's do our part, and together we can turn the tide against any pandemic. What does the future hold for pandemics? Are we doomed to repeat history? The future as it stands is a swirling vortex of possibilities, but when it comes to pandemics, there's a certain degree of predictability. Now don't get me wrong, I am not saying we can predict when the next pandemic will hit or what pathogen will cause it. But we can anticipate that pandemics will continue to be a part of our reality. The key lies in how we deal with them. In the wake of recent events, we've learned some hard lessons about pandemic preparedness, or rather, the lack thereof. The importance of robust healthcare systems can't be overstated. These systems need to be fortified, not just in the developed world, but across the globe. Disease knows no borders, and neither should our efforts to combat it. There's no denying the role of research and development. From understanding how diseases spread to developing effective treatments and vaccines, scientific research is our most potent weapon against pandemics. We need to invest in it, support it, and most importantly, trust it. But what about international cooperation? In the face of a pandemic, we're not just individual countries, we're a global community. Sharing information, resources, and strategies is crucial. After all, a chain is only as strong as its weakest link. Let's not forget, the future is not set in stone. It's a canvas waiting for us to paint our actions onto it. If we apply the lessons we've learned, invest in our healthcare systems, support research and development, and foster international cooperation, we might just be able to change the course of this narrative. The future of pandemics is uncertain, but with knowledge and preparation, we can hope to stay one step ahead. Remember, the power to shape the future lies not just with the scientists or the policymakers, but with each and every one of us.